A new report shows climate change is already taking a toll on our children's health. Research from the Lancet countdown shows a child born today will suffer lifelong consequences because of climate change. Dr. Nick Watts worked on this report, and he's joining us from London this morning with more on what's at stake. Good morning to you.
Good morning. Thanks for having me.
First of all, let's talk about the global effects of climate change and the health effects it has.
Yeah, absolutely. So the report that's out today, it's the result of 35 institutions, the World Health Organization, University College London. We're scattered across every single continent. And it has really one important finding that I think everyone needs to take home. Climate change is affecting the health of children all the way across the world, every single child today. It's not something that affects us in 2100. It's something that affects us 14th of November, 2019.
Looking at Canada specifically, what are the biggest concerns here?
The health impacts of climate change, they are many, they're varied, because it turns out that the environment is everywhere. We just don't quite realize that until it changes. Specifically in Canada, I'm worried about the impacts of wildfires. I'm worried about the fact that our report tracks a 3.5 times increase in the exposures to wildfires in Canada over the last 2 decades. I'm worried about the spread of tick-borne diseases, the spread of diarrheal disease from Vibrio and other bacterial infections. And I'm worried about the decline in crop yields. We have seen up to a 14% decline in Canada in Canadian yield potential. This has some really real effects on the health and nutrition of children, on their sort of lungs, on their hearts as they're growing up.
Many countries around the world have signed on to the Paris Agreement that aims to limit the temperature's increase to 1.5 degrees Celsius. This report takes a look at if we don't change anything, this is the health effects that people could experience. But is signing on to the Paris Agreement, is following up to that commitment, is that enough to curb some of these health consequences?
You're exactly right. So the report does focus on the health impacts of not responding, and we track that life of a child right the way through to the end of their life. But it is so important that we remember that there are sensible, cost-effective things that we can do to respond to climate change that are just good for public health. And that's what the Paris Agreement focuses on. It focuses on the phase out of coal-fired power and what that does to clean up our air. We know that 1 million people around the world die from air pollution every day from coal-fired power. The Paris Agreement focuses on encouraging physical activity, building sort of bike lanes and rebuilding our cities, redesigning them around people rather than around cars, so that we can create safe environments where children can go out and play. There is a second part, and we have a choice about which one of these two futures our children grow up in. The Paris Agreement is one important way to respond to this, but importantly, it's not enough. We have a lot of work to do, but one of the key messages that comes out of this study is that this is good work. It's positive work, it's cost-effective, and it's going to be good for our health.
For any parents that are watching this morning and are concerned, we put up a map earlier showing some of the key target areas of health concerns across the country. They live in any parts of the country and they're worried. What can they do to protect their kids?
Yeah, there's a lot that we can do to respond to climate change. I mean, on the one hand, we have to make sure that we are dealing with the effects of climate change that are here already. And so there are health system responses. There are things that doctors can do. If you're in an area that's prone to wildfires, there are things you can do to avoid the sort of risks there, avoid the air pollution that comes from wildfires. But it is really important that we remember that we can't adapt to everything that climate change brings. And so I think we should be encouraging healthy lifestyles. We should be encouraging more physical activity for our children. We should be encouraging a shift to a more plant-based diet. It reduces the rates of heart disease, of bowel cancer. All of these things are positive lifestyle changes that children and parents can make, but they are also really, really important to protecting the future of our planet.
It's a report that's getting a lot of reaction out today. It's good to have you with us this morning. Thank you, Dr. Watts.
Thank you so much.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.